Very good afternoon, Dr. Erik Fleischman, and to all the viewers who are watching us. And before I, before we start here, I would like to give a brief introduction to the gentleman that I'm having a pleasure of having a conversation today with, and a few words of introduction about my guest today, Dr. Erik Fleischman MD. He began his career as a surgeon and a cancer specialist in the United States, and at one point he was even famous as the Hollywood doctor to the stars, and he was treating Steven Seagal and Mickey Rourke and other celebrities that we're yet to find out. Being generally a fun and life-loving person, Dr. Erik Fleischman has a love for adventures as well, and those qualities of his character, amplified by nearly devotional level of professionalism and dedication to medicine and people's health, have taken him on a journey around the world in a battle against the disease. From a former role as a senior HIV clinical advisor from the President Clinton administration to a healthcare expert troubleshooting in various crisis zones in more than 20 countries in Africa, Southeast Asia, Caribbean, to work in some remote islands in Indonesia and treating Ebola in Liberia. Erik, correct me if I'm wrong. A loving father and a true gentleman by manners and speech, a philanthropist, medical expert, and just a cool guy, a very open-minded person, and still what I call an old school. Dr. Erik Fleischman resides in Bangkok, Thailand for many years. So there is very much in common between us in terms of personal history, career, views on politics, social aspects of life and medicine. And I want to mention that hardly I miss any video of Dr. Erik on social media or any interview with him. And with a feeling of being honored and deep appreciation, I'm informing you that Dr. Erik does the same to me. His kind words of endorsement and recommendation of my professional Facebook page have profoundly touched me and inspired in what I do. These have been...
We're both Ukrainian.
Oh, yeah, if you dig in our roots. So there's been numerous requests from other people, friends and colleagues and followers of both Dr. Erik and mine, for us to have an open discussion on the healthcare maintenance and especially in regards to the COVID-19. So ladies and gentlemen, without further ado, Dr. Erik, how are you doing, brother? Is everything fine?
Dmytro. Doing good.
Yeah,
we're all in the same boat right now, trying to figure out which oar is going to get us to the shore. But I'm feeling more hopeful as I watch the numbers go down. The numbers go down in Asia that we're going to get back soon.
Are you very much affected by the lockdown? I mean, your professional activity, and we're going to talk about the other aspects of life as well, or pretty much business as usual?
No, I've been very effective. So I have a clinic in Vietnam called Fortio American Anti-Aging Clinic, and we're the first regenerative medicine clinic in Vietnam, and we've been closed down entirely. So the government closed the office. They only keeping open what they call essential medical offices.
Mm-hmm.
At Bangkok Anti-Aging Center, we had to close my branch. And so I'm only working 2 days a week at one of our other branches, and we're working with reduced hours. So everybody's feeling it, Dmytro. And I know you're not going to your office either these days.
Yeah. We're pretty much grounded, all of us, so I'm here with the family, trying to take all the best out of it, and be productive in the same time, so writing stuff and all. But clinical work-wise, yeah, we have been suspended in all continents, in Europe, and the same here in Asia. So, this they say about the beginning of May they may open up, but who knows? Yeah, let's see, because I really suspect that it might go until the end of May, perhaps.
Right.
What do you think on that?
I hope so. I do hope it's sooner. And I have a couple theories about that too, that we'll go into. But before I start, I also wanted to say, that it was an honor to meet you. I went to one of the trainings for Biomedica, European Wellness at that point, and heard you speak. And I said, well, I heard the accent. I said, he sounds Ukrainian, so he must be okay. But I also, I saw that you're one of the guys who's actually bringing science into this field and coherent science and evidence-based science into something that before has been ruled by a lot of people who were considered to be snake oil salesmen. And my greatest criticism of our field that we're both in, regenerative medicine, is that throughout the years it's been controlled by people who were using anecdote and supposition, and they weren't really getting some true scientists into the field, so that the validity of what we were doing, just didn't rise fast enough. But with guys like you and your other colleagues that you're working with, guys like me in the field, regenerative medicine right now is finally a real thing. And we finally have, we're getting referrals from other doctors finally. It used to be kind of a battle between standard Western medicine and regenerative medicine, where the even at Bowmangrad Hospital, where I worked for 3 years as medical director, the doctors there will not send their patients for regenerative medicine because they just don't believe in it, even in their own hospital. So I'm glad that there's guys like you out there bringing validity to this so we can move forward and help a lot more
Yeah.
people not get old and
The
die.
specialty was not defined properly. Even the term appeared just about 20 years ago, late 90s, and until now, there's no medical institutions. I mean, educational institutions like that would provide a postgraduate program because there's no such specialty. There is gerontology, and all that stuff, but
Mm.
somehow it just doesn't fit into the main idea of what is done. Plus. That a lot of tools that we use in our practice is sort of translational medicine. So from the research center, from the petri dish, straight into the application to a certain extent. Of course, not on a, put it this way, massive scale. But then again, we have the compounding pharmacy, and all that luxury of using some substances, supplements that been just created, and then people can purchase them online and stuff like that. So that plus, our legs are growing from the conventional medicine. So all the rules, everything apply from there, the evidence base and stuff like that, and understanding how you can actually read the paper, how you can interpret that paper, and how you can use that in your practice, So that's our benefit, I believe. Plus we're enthusiasts of what we're doing, So the biohacking thing, yeah. It's very important. Yeah, to love and practice and experience what we preach and tell to our patients, or teach.
Yeah, well, I always said when I was an oncologist, the the most valuable thing you can give somebody is extra years.
Mm-hmm.
Even in oncology, when and most of our patients, look, most people show up with cancer too late. There's not enough cases that show up stage 1 and 2 where you can guarantee life of a long life and health and everything. But what I found out is that people with stage 3 and stage 4 cancer, people with severe debilitating terminal diseases, kidney failure, liver failure, heart failure, the amount of time that you can give them beyond what they're getting from their standard treatment, you can't put a price on that. And for a family member, you can't give them anything better than extra time. So what I tell patients is my goal in life is to give you more time to spend with your children, because there is no greater gift you can give somebody, right?
Absolutely.
And I'm happy that the science of this has gotten to the point where we can say that to somebody and we can pretty much guarantee it by certain treatments that we're doing and the right people. So this is a very exciting time to be in regenerative medicine with some good professionals.
And it's also, it's a great thing that and very important at the same time to let people understand better on the spiritual level and psychological level that the mere point of existence and the most important point in life is the actual presence now, and being able to enjoy the actual moment and to have the experience. And life is not the future, life is not the projection. Future or anything, any presuppositions, whatever, it's just all inside your mind. It's not really that going to happen. But the reality now, being able to experience and live now, I think that is the definition of life. And by all means, whenever there is a chance to give that extra moments to people. Yeah, that's an absolutely noble idea. Okay, Erik, I have a question for you. I know that you've been involved in your past career in various, put it this way, medical or healthcare crisis troubleshooting. Yeah, I call it this way. And you had to go to some countries which are more or less developed. And although probably the pathogen was different, but the entire response of the healthcare, it should be pretty much universal. So, and I know that you've been trained in the CDC, right? The Center of Disease Control in United States. So looking at what's happening in the entire world now, and I know that your connections, your family, and all your contacts in the United States, so probably you have the idea what's going on there and what's going on here in Southeast Asia, how much different it is in terms of the epidemiology, in terms of the pandemic, and in terms of the responses of the authorities and our further chances, where we're going to end up.
Well, that's a really good question, because I've been through, I started out in the HIV epidemic, and I was at HIV epidemic in the beginning before we had antivirals. And I was just talking to somebody about this today. The overwhelming feeling back then is, oh my God, we're all going to die, because people didn't know who it's going to get, how it's going to get, where it's going to get, what it's going to get. And then the fact that it was sexually transmitted just made everybody think this is universal and everybody's going to be dead in 10 years, right?
Yeah.
Well, obviously that didn't happen. We further defined it. We defined the treatments better. We defined the prevention better. And, now it's, people with HIV live longer than people with diabetes, right? So These are always evolving, non-static situations. And if you've been through enough of them, you take a deep breath when they come on and you say, okay, what do I know? What don't I know about it? And take that all the way up to Ebola. Now, Ebola was awful. That's the worst thing I've ever seen in my life.
What's the mortality? Mortality is what, 40% or 48% mortality of Ebola or something like that, right?
Well, they said 43%, but I think in our experience, it was quite a bit higher than that. Now, that's also because there was not good coherent medical care for it. I mean, we were setting up clinics in big tents, with dirt floors, and we didn't have supplies, and we had to wear these, we couldn't treat our patients the way we wanted to. If Ebola had happened in a Western country, which it wouldn't by nature of the disease, I believe that the survival rate would have been 70% or something like that, because they would have done the important things. And this gets back to what you're talking about. The important things would have been early response to the disease. Early response to viruses is the only way to beat viruses and live. Not late response, not throwing in salvage therapies. It's got to be early response, and that early response has to be to stimulate the immune system and fight off the virus. That's all we have. So
you mean the early response both on a general scale of the healthcare system and also the earlier response from the every individual, in terms of, yes, you got to be more prepared to face the seasonal flu or any possible projected or predicted pandemics, right?
Right, but this one nobody could have predicted. Everybody is kind of quick to spread blame around right now. The WHO didn't warn people, and the responsibility of that. Now, I've worked when I was with the Clinton Foundation and with the State Department during the Ebola crisis. I worked with a lot of WHO people. My thoughts were that, the WHO is not the only group that is involved. They are just the most visible
and
group that is involved. Probably. I found them personally to be a little more political than humanitarian. That's kind of their job. They're supposed to determine the political and population overall gross effect of it. Now, did they underestimate it? Yep,
well,
they did, but
they have people who are finding them also, so the funds, wherever the funds are coming from, the top 3 or top 5, they literally have to blow their whistle, and then just dance along the tune, so whatever they tell them. So they are biased in a way.
It's a lot of would have, could have, should have, and I understand that, but none of that is going to get us past it. So I don't personally like to dwell on that. I like to move forward and say, okay, here we are.
Hmm.
What are we going to do? But that's because I've been in that situation. But this epidemic, epidemic, the rest of the world, they saw Ebola, they hated it, they thought it was awful, it was terrible, but they didn't experience it. And they had this idea that, well, this is awful, but boy, that could never happen here. You know, now COVID is affecting everybody. It's not just affecting poor Africans. It has not spared any socioeconomic group. It's targeting old people everywhere. So the response that people have is what you would expect it to. They're scared. I feel bad for them. I don't feel as scared because I have a few facts that I count on. And this is what I know, this is what I don't know, so I'm going to do what I know, and I'm going to
Well,
use the knowledge that I have about it so far to try to get a little bit of control of my own response to it anyway.
great. That's exactly what I actually wanted to talk about, and the entire purpose of this conversation is let us try to dissect at least what we know for sure, okay, about this entire COVID problem. And let's start with the virus first. Well, we know that it's been called as a novel coronavirus, but we have been encountering that for a few decades, and this is definitely not the first pandemic. So we had the SARS, we had the MERS, and we had the similar stuff happening for 18 years. Uh, I would like to know your take on were we really that well informed about this virus? And looks like from the literature that we were quite well informed about it. So where the mismatch happened, that although the scientific community and medical community knew pretty much, even the chloroquine as a treatment modality has been described for coronaviruses in 15, 17-year-old articles. So why are we sort of acting like we have been totally uninformed, unprepared, and this thing is like catching us off guard?
Well, I think the only thing we were unprepared for was the rate of transmission. I think otherwise, from being in a hospital, a pneumonia is a pneumonia is a pneumonia, and the treatment for pneumonias are fairly, if you're a doctor, they're fairly routine. Support the breathing, kill the infection, support the body fluids, things like that.
Yeah.
And it was the same thing for Ebola. That's all we could do for it, and let the immune system take over for killing it, which it does if the virus doesn't kill you. Right? That's all the
Right.
same. So to say we weren't prepared for this medically, that's not true. We just weren't prepared for the volumes in certain areas. Now
Mhm.
I have friends in New York City, and they're telling me, there's a lot of rumor and stories and about, packed ICUs and things like that. And then there's other hospitals that aren't getting any business whatsoever because people are staying away from it. So I remain skeptical as to the media's presentation of the virus.
Mhm.
I think we have seen enough cases to understand the biology of this virus,
Mhm.
unless it starts mutating very quickly, which, thank God coronaviruses don't usually do. But that would be a huge problem if it did. Um, but
But
otherwise, I think
it
we do
mutates
understand
some
the biology.
6 to 20 times slower than the HIV virus. The HIV, correct me if I'm wrong, but it's one of the fast mutating entities. Well, if you don't consider the virus to be a form of life, which is some kind of the most fast change in informational code, put it this way, in entire biology.
Right.
Yeah. So
But I
this one.
think with HIV, that's also by virtue of the amount of time it gets to mutate before it's ever discovered, right? The faster you
Mm.
discover a virus, the faster you kill it, and the slower it mutates. Whereas
Mhm.
HIV has anywhere from 3 to 7 years to do it.
Yeah.
While the body is trying to fight it off when patients don't even know they have it. So I
True.
think that accounts for a lot of the mutational strength of HIV,
Yeah. Yeah.
which
Yeah.
is another reason why we have to kill
every every
coronavirus.
uh, every transcription of the DNA or the RNA of the virus will ultimately, because it's a single strand, and also it's very easy to mutate. Yeah, so
Right,
at every
right, right.
replication, it is mutating at a certain extent. Yeah, so described by generations by how many kilobyte of genomic error per year and stuff like that. That's very interesting
Right, right.
calculation
It's
for that.
fascinating if it weren't so awful.
Oh yeah, absolutely. Absolutely. So, um, well, indeed, yeah, looks like that if you compare to the previous, the SARS coronavirus 1 and to MERS, this virus is less lethal. However, the ability to spread is much exceeding the previous known coronaviruses. So that's the whole thing, you know. And although 80% of the population or whatever may just go asymptomatic, but those who are hit by this, you know, they are hit by this really, really bad. So we have these groups of risk generally, right? So what we would include the obesity, hypertension, metabolic syndrome with diabetes type 2, and
Age.
old age and cancer, immunocompromised patients. Yeah.
Right.
So by nature of invasion, the ACE2 receptors, you agree with that? So
Yes.
yeah. Does that explain why in Italy, if I'm not mistaken, and if I'm not mistaken, Spain, hypertension is the #1 most frequent underlying medical condition in the patients, in those who died because of the COVID-19, something like that?
It could be. I haven't really looked into that as much. I've been more focusing on the immune responses, but it absolutely could be that. And the I wish I could. I always feel better when I can explain something. You know what I mean? Even if
Yeah,
I can
yeah.
come up with a hypothesis, but for the grossly higher numbers of deaths in Italy and Spain, you know, the age range of the patients was higher. Apparently there's a more mobile elderly population, whereas in
Mhm.
other countries like the US and Asia, you know, the older people are less ambulatory and less out there.
Average
um,
lifespan in Italy is about 85 years old, something like that,
right, and a
on
very
average.
active 85-year-old, whereas in America, you know, you rarely leave the house if you're 85.
All right.
So I mean, that's what I see, but I think you're absolutely right. Hypertension, diabetes, obesity, old age, um, those are really important, and they're going to be even more important as we start to finally move forward, if and when we do, and I do
Mhm.
believe we have to. Um, it seems that everybody wants the perfect. Okay, everybody stay inside and nobody gets infected, or okay, well, you people can go out and start to have a life, but we got to protect these people, the
Okay.
same ones we talked about, the obese, the diabetics, the risk factor people. And for many countries, coming to that decision culturally is going to be a very difficult problem. Coming to that decision medically, to me, is a no-brainer, right? You're at risk, they stay away, everybody else, let's keep society going.
Yeah.
And I
Is
think we're
that
going to have to
doable?
bite the bullet.
Is that doable? And do you think that would be doable universally in all cultures in all countries of the world, or how? You know, because
No,
still, you
I
know
don't.
how they say sorry. You know,
Yeah.
in the very beginning of like a month ago, in the mid of March, when the massive these global lockdowns have started, they said that if you are even well, you have good immunity, but you can still catch the virus, you be asymptomatic, and you can be able to spread the virus without knowing that for about 4, 5,
Mm.
6 days, and you go back, you ultimately will meet your grandma, grandpa, auntie, and so on. So you will put them at risk. Um, well, do you think that we can find some kind of the golden rational center, you know, in this, so that we don't affect the economy, we don't affect the life of the majority of the people, but we still can protect those who are at risk? Is that possible everywhere?
It won't be perfect, is what I can tell you. And what I would relate this back to is the way that we managed Ebola in Africa. It was the same thing. We
Hmm.
saved who we could, and those who had to die, we had to let them die without causing death to somebody else. That sounds awful to have to do, to make those decisions. And in the Western world, we rarely, you know, we kind of have the luxury of not making that decision because the medical care is so good for everything else, even for cancer. Um, but in this case, there won't be that kind of choice, and there's going to have to be, as awful as it sounds, an acceptable level of death that comes, because not everybody is going to be able to isolate the at-risk people.
Yes.
And but you know, your other alternative is staying inside and keeping everything closed forever, which is going to have a much larger effect on the functional population who are going to die, not flourish, and not move forward. So it's kind of a Sophie's choice. I mean, there's just not a perfect answer here.
Yeah.
Even worse is that no politician wants to be the one to pull the trigger on this one, because they're damned if they do and damned if they don't. So, for any of these governors and country leaders, boy, I would not want to be in that position, even knowing as much as I do. But in reality, I think it's going to have to be similar to what happened with Ebola. We can save these people. The other ones we just can't save. We're doing our best.
Yeah, yeah. As long as we don't delay too much and we cross the Rubicon, and there's no turning back after that,
Right.
Because I believe that now the unemployment rate in the USA is like staggering high, from being the lowest unemployment rate since the President Reagan administration to now, like, they are projecting, if this will not stop for the next couple of months, like up to 40% or something like that. And plus the people who live on the minimal, how do you call that, daily wage or something like that, and
yeah,
it's really a tremendous impact. The daily workers here in Southeast Asia, and my family, we try to support that, just contact the NGOs and just buy and cook food for people, and distribute that
right.
in the afternoon and in the evening, so, and it's like 150 to 100 people, at one go, so at least something. So give us some good news, okay? It's been a little bit too grim, give us some good news.
Yeah.
What's the overall rate of recovery?
The rate of recovery, well, it's interesting because now they're coming out with more data for asymptomatic infections. And there was recently a bunch of soldiers who were infected on a aircraft carrier. They were all together, and they found out there was something like 600 asymptomatic people, asymptomatic soldiers, because these are young, healthy
those
guys.
Are fit guys, yeah, absolutely, with a perfect immunity and no underlying conditions.
Right, that's my point, because that actually is most of us. Even young men like us who are advancing a little further.
Let's agree to disagree, because about up to 60% of males above age of 40 years old are not able to do 45 push-ups at one go, and that also increases the risk of heart attack, by some 40%, something like that, so that's debatable. Right. And, from country to country, I've been going to United States for the past few years quite often, and people were saying that there was a general sort of like an opinion that America is quite an obese country. But indeed, the amount of overweight people there is really, really huge. Yeah, and
no pun intended.
When you go for the breakfast or lunch in the restaurant or in the breakfast in the hotel where you stay, you sort of you see the big difference between the European diet, European breakfast, and even the Asian breakfast. Maybe Asian breakfast is also not the healthiest one, not the healthiest in the world, but still, but still better than American breakfast. And it's all the processed food and all that, stuff with that sweet syrups, and all those pancakes, oh wow. And the free flow carbonated drinks, the Pepsi, it's free flow. I was watching one endocrinologist lecture, and he was saying that when he was a kid, and his grandpa, some middle of the 20th century, used to take him out on a Saturday, and he used to drink one can of cola, or whatever soda per week. And then now it's like few drinks per day of this stuff, it's really, really, really horrific.
It's poison. It's amazing. I think that these high fructose drinks, I mean, call them out by their name, right? Pepsi, Cola, Fanta, even the high, the quote fruit juices that have nothing but high fructose corn syrup. These should be regulated and licensed even more than cigarettes.
Absolutely.
Because I believe they are killing a lot more people than cigarettes are. And when I see people, I don't have them in my house. My kids absolutely don't drink them. I'm sure it doesn't exist in your house too. But yeah, when we were young, I mean, I grew up on all that. I had several cans of that a day, and it was great and made me feel good. But no, you're absolutely right. But there's another topic I want to talk to you about. I want to know your thoughts about this, because I've been looking more into this. So we know in regenerative medicine we know that there are certain proteins that the body can be stimulated to make that have an anti-aging effect or an immune stimulatory effect or a regenerative effect.
Hmm.
So I've been looking more into the presence of heat shock proteins, right?
Okay.
Now there's some great studies. They're not hugely scientific, but they're out of Scandinavia for people who spend 10 to 15 to 30 minutes a day in jacuzzis or mostly steam rooms,
Also on a.
and and saunas, and they looked overall at their health, their heart disease, their level of hypertension, their stress factors, stress hormones, and it was always striking that these all had a positive effect. Now, I've been
Yeah.
thinking more about COVID-19. Now, we know for sure that colder countries do worse. The infections are more prevalent, the deaths are higher, which means there's probably more symptomatic people because the bodies are not fighting off the virus.
Hmm.
So I started looking more into what heat shock proteins do. And as far as an immune response, heat shock proteins, those tiny little proteins, they actually help to present the antigen to the antibodies faster and more efficiently.
Hmm.
So I'm wondering if, we know that coronavirus probably doesn't like heat, but I'm wondering if because we live in extreme heat environments, if we just have that much more efficient of an immune system in processing antibodies to kill COVID. What do you think about that?
If I'm not mistaken, one of the mechanisms of action of these heat shock proteins is that they have the ability to stimulate the NK cells. And
Yes.
the NK cells are nothing else. It's the cells which belong to the so-called innate immune system. So the system which is not adaptive immune system. It doesn't require priming or any pre-existing information about the antigen. This is our inborn immune systems. And apart from them being extremely efficient against the cancer cells and viruses, bacteria, and stuff like that, but the mechanisms through which they work is the antigen presenting cells. So they are the efficient messengers. They tag the virus, and they can present that to the cell, which is performing the adaptive immunity, the T cells and stuff like that, And apart from that, other components of innate system, like the interferons and all that, one of the mechanism of effect of the coronavirus is that it slows down the production of the type 1 interferon. And that actually enables the virus to replicate itself for about 3 to 5 days and being invisible for immune system.
Mm.
To me, whenever it's a sauna or a steam bath or something, or a systemic hypothermia, this is still a systemic hypothermia in a way, So what it does increase the catecholamines, the endorphins, and also it does increase, and same goes to the LED red light therapy, and they call it also low level laser therapy, or any forms of biophotomodulation. So what it does, it also increases the nitric oxide production. So you have generally a vasodilation, a better perfusion to your periphery, to all the parenchymal organs and all. And plus it has that stimulatory effect on the immune system, on the innate NK cells and stuff like that. In these regards, I was also, and I'm a big fan of this, alternating temperatures. I know that it's not that easy to do in Southeast Asia, but there is a service where you can buy the huge amount of ice and they will deliver that right straight to your home. You can fill in your bathtub, you can dip yourself in, or you go for those cryogenic chambers and all. That's a fantastic stuff, because that a short term, that momentary effect of a low temperature, and that change, in the temperature, it's like it's a tremendous shake to the whole body, so you activate all your primal existing repair mechanisms, so through multiple ways, So I believe that that's a great idea. Whether and how it can be used for the actual patients who are ill, that has to be tried, I believe, yeah, and then tried carefully, because giving exposing to a hypothermia, yeah, absolutely, the patient with fever, but as a sort of like a preventive measure, when you just do that on a general scale, or at least you identify the group of population which will benefit from that.
Yeah. And
Yeah.
I think it's also something, we always try to suppress fevers. And I think in early infections, I do too. When my kids get fevers, first thing I want to do is get rid of the fever because I
Mhm.
want them to be comfortable. But I think with this disease, the recommendations that I've been getting is that you should not suppress the fever early on. Let the fever run as much as
Mhm.
is safe.
Mhm.
In adults, it's safe. In infants, you don't want to do that, but fortunately, infants aren't really getting that sick from it.
Well, it's because of the dehydration mostly. The infants are easier to be dehydrated. So as
Right.
long as you can keep the hydration level adequate, and well, yeah, you just properly calculate the amount of fluids. You know what you're gonna lose extra to every increase on the degrees
It
Celsius.
still scares it when it was my kids. Thank God they're older now. It scared the hell out of me when they had a high fever. I am not a pediatrician by nature, but what I have been doing in my building, there's a steam room,
Hmm.
sauna that's still open, and I do bring the children down there every day, and they hate it, but I do bring them in there, and I make them sit in there for 10 minutes, and I make them breathe in deeply, so that the airways are getting exposed to the hot steam,
Hmm.
that can have a direct
Hmm.
effect on killing bacteria and viruses, but also I figure it'll stimulate the heat shock proteins
Hmm.
locally to have those areas be a little more surveyed. And I'm trying to get my clients and educate them more to this, so that they can start to do whatever they can do to try to stay warm during this time period, whether it's heating the airways up. If they have a sauna, they should use it 10 minutes a day. We can't really treat this thing, so we do have to do more prevention.
Hmm.
Um, and the more people we can prevent and get out there with healthy immune systems, those are people who can get back to work faster and start becoming productive again. And I mean, that's where I want to start focusing things now, so we can move past the doom and gloom of self isolation onto the fear of being with other people.
Have you heard of these guys? There's a group of friend of mine, and he's Christian. He's the founder, the CEO of the company, and they're all foreigners and expats. But they've started the company in Thailand. They have an office and laboratory and manufacturing facility in Chiang Mai. Okay, so I've been there. It's really fabulous. So what they're doing is red light therapy devices for home use and for the clinical use. The clinical use,
Mm.
it's a big thing like a C-arm, and you can rotate it, expose different areas. And the home use is like a flexible thing. It's called FlexiPim. You can attach to various parts and also. And I tried that myself. It's really wow. And if you're a biohacker or if you have weak lungs, for example, or pre-existing COPD, doing that is really something that worth looking into.
It's a
So
great
apart,
idea.
apart from this, what would you recommend to take in the form of supplement? And again, not advocating any treatment, not advocating any brands or
Oh,
whatsoever.
I'll
Just your
advocate. I
general.
want people to do what works.
Oh, wonderful! Yeah, okay. I'm up for
um, I am a big believer in the effects of vitamin C with viruses. So I think just standard people should be taking between 1,000 and 3,000 milligrams a day. They should actually be taking more, but when you go above 3,000 milligrams, you start to get a lot of upset, upset,
acidity.
upset stomach and indigestion and things like that.
Okay.
Um,
Liposomal,
in Yeah, yeah, probably better. But I think
better
not
absorption, right?
everybody can get. Yeah, not everybody can get it. If you can't get it, it's with vitamins. As we all know, you're not getting 100% of what you put in there anyway. But
Yeah.
fortunately, it's not that exact a science. Where you can overload it and survive it and still get enough
Yeah.
vitamins in. I'm a very big believer in intravenous vitamin C. I was one of the first people using it against HIV back in 1992 for my
Hmm.
patients who had viral storms. Back then we only had AZT and people were actually dying from the AZT. So a lot of patients wouldn't take it.
What should be the
So,
right dose? Because usually the problem with the vitamin C is that when people say high dose, they're actually not even talking about that near high dose as it should be. So Can you please
Sure.
educate people what exactly is that high dose vitamin C that everyone understands? It's not like
Sure.
1,000 or
What I
2,000.
used to do to increase energy and increase well-being was between 10 and 15 grams. So
Hmm.
10,000 to 15,000 milligrams. And then when I had patients I was treating for acute infections, especially viral infections, I would use 20 grams. 20 was about the ceiling that I was using because we were getting good results with it.
And just once per
So
day.
20,000 milligrams.
Once per
Sorry?
day. Once per day.
Once per day, yeah.
Yeah.
Now,
Hmm.
I wouldn't do that on consecutive days in most patients because I didn't think it was going to be that effective. But I would definitely put a day in between if I was gonna use that amount.
And preferably
Um,
not to use the acidic form, right? You use better the ascorbate, which is
right,
less acidic, yeah, more suitable for
right.
the
But all
liver.
all the forms are very. There's some theoretical advantages to using other certain brands, but clinically it's very very well tolerated. I haven't. The only time I ever saw any kind of problem with vitamin C infusion is if it was infused too fast and it makes people throw up.
Hmm.
Seriously, that's the
Yeah,
worst problem I've had with a vitamin C
yeah,
infusion. Knock wood.
yeah.
Um,
I'm
but
doing for
high
myself
dose.
usually up to 40 gram, and I do that at the infusion within 10 to 15 minutes. Yeah, so
So you feel like you're going to throw up after a while. So yeah, if it goes in
I
too
feel
fast,
okay. But on about 15th or 20th second, I literally feel the taste. I can smell myself, and after
yeah,
that, the whole day, I smell to myself like the pharmacy. But I love that, and it gives me that charge. As long as I don't overdo it, like once in 2 weeks is more than enough.
right.
To biohack yourself. So yeah, that's a great thing. Vitamin D, what do you think of that? I've been watching your video, and I love
Yeah.
your video about the vitamin D. I myself, I'm a vitamin D fan. Okay, absolutely. So what's your take on vitamin D? And then please start with a favorite words of mine that, ladies and gentlemen, the vitamin D is not even a vitamin, it's a steroid hormone.
Vitamin D is not a vitamin. Vitamin D is a hormone. Calciferol is a hormone, but it's called vitamin D. So when I started doing regenerative medicine, we started really looking at vitamin D. And as you see more and more patients and you test more and more of it, um, in my population, which is Asia, which is Southeast Asia, people, as much sun as we have here, people don't like to go out into it. And I was
Absolutely.
finding out in Vietnam that probably 40 to 45% of my people had substandard vitamin D levels. And I'm not just talking. In Vietnam, they say the level of vitamin D should be 20 to 50. We know now if you're at 20, if you're below 30, it's too low. So
Yes.
that was
Yeah.
their standard. So the amount of people with low vitamin D was even more than that.
Yeah.
And vitamin D, as you know already, but I'll tell everybody else, has some tremendous functions in the body. If you have high vitamin D levels, you probably won't you're not as prone to get colon cancer. That's already proven. For other
Mhm.
cancers, they haven't exactly proven it, but they have proven that people with high vitamin D levels do better on chemotherapy than people who do not take vitamin D.
Mhm. Mhm.
Vitamin D is very much responsible for your immune response and for natural killer cells. It is responsible for your mood. Um, People have found that low vitamin D states result in depression. And I had one of the few psychiatrists that I really trust. He's in Hong Kong, Dr. Mark Gandolfi. He had been using it for years and giving people 5,000 to 10,000 units of vitamin D for depression. He gave it to these people during the day, and their depression was getting better. And that's
How much are
that's a
you
lot
taking?
easier than putting people on.
You
I take
yourself,
5,000 a day.
5,000. I
Five
take
thousand a
5,000
day.
as well. Yeah. And
Yeah,
the interesting thing
but
is
it.
that I did check myself. When I started 1.5 years ago, I'm taking it non-stop for 18 months now at 5,000 international
Mm,
unit per day. When I started, my level was 38 or something like that. And after about 10 months, I was just somewhere in the normal range, just lower normal range, And my personal target and what I recommend, is just when you reach like 130, 140, then you just step down and take a very low maintenance dose, like 800 international units or whatsoever, because what people think that the high dose is supposed to be, I think that's underrated, so the
It
actual
is.
that
I
efficacy is
agree.
when you're 120 to 140. You don't have to go beyond that. You don't have to push yourself in a hyper, whatsoever, which is unlikely, to be honest. And we all know that as older you become, as older you, as more you grow and older you become, the less and less you will have eventually of the vitamin D. There's a sort of like the age adjustment for that. So just by a factor of the age is a factor, you'll be already getting lower anyways. And then if you want to get it from the sun, you have to expose yourself for 1 hour and being absolutely naked, which is definitely is not applicable. You know, everyone is
Yeah.
hiding from the sun here. Yeah. So yeah, so oral
Yeah. Yeah.
supplementation.
I go out on my balcony, do that, I get a lot of complaints, but I tell them that I'm just working on my vitamin D, but people
It's a
are good
medical
treaters, so
necessity. A medical
it's a
necessity.
medical necessity. So I just tend to take it by mouth then. But one of the other really important things, because you know me, I'm as much as you're Doctor Stem Cell and Live Cell, I'm Doctor Hormone, and I believe hormones are the
Absolutely.
entire basis of
I'm all
staying young.
inclusive,
And
Eric. I'm all inclusive. I'm not just into the cell therapy. I'm all inclusive. Absolutely. Which
but the
certain forms of it, but
proper
definitely I don't
hormones.
have your experience here.
Yep.
So I would like to hear about that.
Well, proper hormone production of testosterone, of estrogen, of progesterone cannot occur without normal vitamin D levels.
Mhm.
And there are even studies showing that women who go through early menopause tend to have low vitamin D levels. And in Asia, it's been my experience that the women that I treat, I mean, they would rather go through anything else in the world than menopause,
Yeah.
because to them, losing their menstrual cycle means that they are now old and they've crossed the line, and they get very depressed, very worried, and this is a very male-dominated society here, so they worry about their ability to maintain their marriages and everything.
Yeah.
Seriously. So I always tell people that they call it vitamin D, but I put vitamin D somewhere in between hypertensive medicine and vitamin C. I don't think it's quite an antihypertensive, because you can
Mhm.
survive if you're not taking it, but it is something that you can't just take once in a while. You must maintain good vitamin D levels in order to have a normal immune system, neurologic system, focus in your brain, uh, healthy liver and lungs, liver and kidneys. So I think it's really, really important.
Speaking about hypertension and just reducing your risk, or not even the risk, rather influencing the main biochemical mechanisms of the vascular wall relaxation. I also use, and for myself as well, the L-arginine and the magnesium. Because magnesium is the fourth most required and most important electrolyte, put it this way, after calcium, sodium, and all, and the magnesium is number 4. So, and it's directly is involved in the relaxation processes. So you have better moods. You can sleep better. Generally you're more relaxed. But also your blood vessels are more relaxed. So together with the L-arginine, which L-arginine, by a very simple reaction with oxygen, it just creates the nitric oxide, NO, which is the major factor that is regulating the tonus, of our vascular wall. So are you taking those things? Are you using that in your practice?
Yes, although I take them for a different reason. I take L-arginine. I'm also, as you know, a very big believer in growth hormone and growth hormone maintenance.
Okay,
Um,
so this is debatable. Okay, I would love to talk. Okay, just tell your take. Then I put my
Sure.
five
Well, let me
cents.
go on for it. So,
Yeah.
it's been my experience, working with growth hormone and working with people with growth hormone over such a long time. The higher your level of growth hormone, the more active and the younger your immune system is. So, older people with higher growth hormone levels seem to be much more immune competent. And in patients where you would actually expect, in theory, to see more cancer from high growth hormone levels, I've never seen that in the patients that I'm with, because I believe that the immune system is hyper stimulated to the point where it's even surveying better than it would otherwise. But the reason I take L-arginine is I take it with, I take 1,000 milligrams of that and I take 1,000 milligrams of GABA, because these
Yeah.
two supplements, along with intermittent fasting,
Hmm.
good sleep, and intense exercise, raise your growth hormone level naturally.
Yeah.
And
Okay. So
I
you
attribute
you mean
my
you
own.
you try you
I'm
try to
trying to,
implement? Yeah. Sorry.
right. I'm trying to boost my own growth hormone levels, and I've focused on my own growth hormone levels since I was 42, because that's when it got popular, and I'm 60 now. And I do believe that a lot of the reason I've been able to stay young and vital and slow down my aging process is because I've had such attention to the maintenance of growth hormone.
So you mostly you mean that just maintain the growth hormone with whatever by other means as much as possible, but not the use of the growth hormone as a therapeutic agent.
Intelligent use of growth hormone in a reasonable way, I believe in.
Okay, there's been studies, this is an extremely interesting topic. We need the growth hormone, the IGF, and all that stuff to grow, obviously, so until the age of about 18, 20 years old, the more we have that, the better. However, there were studies that, especially studies done on the centenarians, the people who are like 100 years old and above. So the high level of the growth hormone is not actually associated with longevity. So those people who live like up to 90 or 100 years old or beyond that, they actually have a lower on a general scale growth hormone. It's more like you are in a self-conservation and longevity and a slow aging state rather than you are constantly repairing yourself.
Mhm.
What do you think of that?
I think it's hard to separate those things out one at a time and variable for variable, because the longevity, as you know, also has a lot to do with the body's other regenerative abilities and the other hormones and genetics and things like that. There's always been that. I can only speak anecdotally from my practice that that I've been focusing on growth hormone and using it, like I said, intelligently, and not overdoing it for the last. Well, I started using it for people in 1994, so that's a long time right now. I've found that the intelligent cyclic use of it, not constant
Hmm.
use, not super high doses,
Hmm.
has allowed people to slow down or speed up the regenerative process and slow down the aging process by somewhere between 20 to 40% in some
Okay.
people. So it's not done. I agree that if it's done constantly on people, I don't do anything constantly on people because I respect the body's feedback systems, right?
And the
So
hormesis principle too,
exactly,
Yeah.
hormone
Yeah.
replacement, yes, do it, but let the body recover when it can. Growth hormone, same thing. Boost the growth hormone for a while, slow down the aging process, increase the regeneration, then stop. Let the body go back to homeostasis for 4 to 6 weeks, 8 weeks, and then do it again. And that, when I say the intelligent use of it, that's what I'm talking about. Now, there's a lot of really good therapies out there that have not been used correctly and have, thus been seen as kind of a boogeyman. Same
Mhm.
thing with stem cells and live cells. It's a
Yeah,
fantastic way to
95% of people
regenerate.
are abusing this. 95% of
Exactly.
clinics, yeah. Sometimes people don't have a clue what they're doing, I mean,
Right.
and
And I think
they
that
just.
muddies the waters when we talk about what
Yeah.
they can and cannot do. So I think
Mhm.
the intelligent use of any of them can have potentially fantastic results. And I've been very lucky to see those results. And after doing it for 20 something years, I still continue with it because I've seen it work well, and I haven't seen any cancers that were caused by growth hormone, none at all.
Mhm.
Um, and I mean,
How
if you
often
want
do
to look at
people overdo?
Hollywood, if
Yeah,
you want to
how
look at
often people
Hollywood,
overdo? Yeah.
when I was a Hollywood doctor to the stars there, these guys would get on and say, "Look, I do yoga and I drink chlorophyll, and look how young I am." Well, no, they were doing growth hormone predominantly, and it did have a tremendous effect on their appearance when they were using it right.
Eric, I know that there are situations when the patient may not be absolutely honest with the doctor. Okay, they might hide some things and all. And
You think?
oh yeah, I've been witnessing that, and been involved in that, to say the least, few times. And we both know that when you do these therapies, what you do and what I do and all, you literally feel great. Okay, you feel like you have 10, 15, 20 years off from your shoulders. Your muscle pain is gone. You recover faster. Your brain works better. Your sleep is better. When I'm doing heavyweight lifting, which I'm doing now almost every day, in my apartment with huge dumbbells and all. You have that bone pain, sometimes, and that sort of comes like in your late 30s. You don't have that when you exercise in your 20s and all. And I believe after 40s, and now you're 60. Well, I thought that you're much younger. Actually, I missed the actual point of your age. So now when I'm past 40, and I'm going on my 42 now. So I have that bone pain, and also I know that when I'm doing certain treatments that I'm doing to my patients, when I'm doing that to myself, I'm off from that. I'm absolutely great. And also, we know that our patients sometimes they feel the same. So my question is, how often do you think they might be secretly overdoing it and things going off out of control?
In America and in Western clients, there was quite a bit. In Asia, I find that they maybe because they have a higher opinion of doctors and less of a self-importance, they tend to follow it to the right to the level where they will absolutely stop something dead on if you say you need to slow down. But I think in the Western countries, I think it happens quite a bit, especially because the kind of clients that we get seem to be a little more self-motivated. If they're trying to do regenerative medicine or stay young, that they've been searching on their own for things that are going to be that fountain of youth, and they've been doing a lot of trial and error as opposed to only do what the doctor says.
Plus, it's an investment. They have to put a certain amount of money in that, and then the products and all
Right.
that ain't cheap sometimes,
But I think with clinicians, I mean, especially with clinicians like you, a lot of times it's because they're afraid to tell the doctor. They don't want to disappoint the doctor. But clinicians like you and I think we're able to have very open open discussions with the patients about just about anything. And I think that when doctors do that, then the patients are more comfortable telling us things we don't even want to know about them. I've had people tell me stuff where I've gone, oh my God, is there anything I can say that'll stop you from sharing your next thought with me? But in general, when we know our patients better and you approach them better and you say, listen, I'm not going to yell at you, but I'm responsible for what you put in your body now. How are you doing this? And with a clinician like you, I'm sure your patients tell you everything.
Well, mostly, but sometimes, with certain things, and especially when people coming from other countries, sometimes patient may have, and that's what some of them told me. They say, I have one patient in US and I have one patient somewhere in Spain. And, one doctor in US, one doctor in Spain, and you're my third doctor. Or, apart from you, I'm also treated there and here. So they are not telling sometimes what exactly they're doing on the other side, because you already told them that, well, maybe you have to slow down or stop doing that, for the time being when you're doing this type of treatment, So, and they don't want to lose that momentum, that great feel. Are you an example for your patients?
Yes.
In terms of in the lifestyle and all.
I think that's vital for any doctor in regenerative medicine. If you get a regenerative medicine doctor who looks like he's 90, he's 200 kilos, and he's got a cigarette in his mouth, I don't think that's really going to inspire a lot of confidence in the patient. I'll tell you a funny story. My father was a doctor. He was a general practitioner. He was an old school general practitioner. And he actually used to smoke in his doctor's office. And I actually did see him once look at a patient, cigarette in his hand. He says, if you don't quit the effing cigarettes, they're going to kill you. And I said, wow, this is a true story, man. But those were the old school days where doctors were gods, and it was do what I say and not what I do. But now we have a very sophisticated and informed clientele who are looking to us to lead the example and to trust us enough to do some of the things that if other people were prescribing it, it would actually be quite dangerous for them, So I know just like in fact, I think you take way better care of yourself than I do, um, because you cut down the alcohol and everything. I still, admittedly, I like whiskey once in a while. I still like
What's
cigars
your
once in a
favorite?
while.
What's your favorite?
Favorite whiskey?
Yeah.
We would have to extend this podcast for 3 more hours, but there's a bunch of them. I'm very
And
very.
tequila. I know you had some tequila tasted in Bangkok last year or something, and I was like,
I do like
OMG,
tequila.
why am I not invited? So next time when I'm in Bangkok, we're gonna hang out together. That's for sure. What's your take on
But
coffee?
I think coffee is good. I think it shouldn't be used more than once or twice a day. The stimulation effect of caffeine is good for the immune system and very good for the brain, actually. Um, but I think too many people like too much strong coffee,
Hmm.
and they end up with anxiety, and they create stress hormones
Hmm.
just from the
Hmm.
use of too much coffee, and that's bad for your hormones eventually.
Do you
But what
do
I
you
was saying
fast?
to the patients, my patients come in and they're afraid to tell you that they, like, we always ask them, do you smoke cigarettes? Do you drink alcohol? It's on every doctor's questionnaire. And they'll look kind of sheepishly, like they go, no, I don't smoke, but I do drink. And I go, that's okay.
That's all right.
You want to create that environment of honesty. I said, if you're going to do something bad for your body, you must do something good for it. We're not building monks and nuns here. We're trying to help people live within their lifestyle, and give them a healthier way so they can enjoy what they do, not live to support my treatments.
Yeah.
And I
Uh,
think that's important to get that
I
conversation.
always tell to people, that taking carbohydrates or sugar or refined sugar and all that stuff that is much more harmful and dangerous to your life and health and all, rather than maybe once in a while, to have a drink. Although alcohol is a sugar, in a way. So, but
Yeah.
yeah, well, as long as you don't overdo all that stuff, then probably you find yourself somewhere in between, so you're gonna be like in a safe zone, and just be reasonable and have just reach out for professionals, practitioners, people like you and me, and always up there and always open for discussion and all. By the way, are you doing telemedicine?
Yes, I'm doing a tremendous amount of telemedicine right now.
Can you educate a bit about that? Because I had a talk with one of the companies, and we're gonna start for our clinic in Philippines. So we're gonna provide something that will be the
Right.
baseline, for clientele. But tell what you're doing in Bangkok now. How does it work?
Well, I signed on. I work for a number of different companies. I thought I was semi-retired, but no, I'm working more than when I wasn't semi-retired. But I signed on with a company called Teladoc.
Tell it
No,
all.
Teladoc is one of the biggest telehealth services in the world right now, and Teladoc is buying up a number of different smaller companies. So they had bought the company I was working for in China, and so before I was just doing second opinions, occasional second opinion things that were going on from insurance companies. But now, I'm doing probably 3 or 4 shifts a week trying to diagnose COVID, undiagnosed COVID, talk people down off the ledge when they think they have COVID and they don't really have it. And so many of the other things that people have that they're now afraid to go to the hospital for, right?
Oh yeah.
If you have a cold, or if you have diarrhea or belly pain or arm pain, you go, I don't want to go to the hospital because I'll end up getting more sick than before I walked inside.
Is
So it's
it
been a
this, or
huge,
people
huge
are
uptake.
afraid of just the fact of being diagnosed positive? Don't you think that there's been like it's a bit been stigmatized, and I believe in China more than in other countries that if you have a COVID, you're sort of like a danger to the society, and people would prefer to hide it, or something like that. I
Mm.
actually think that ultimately we should all be immune to that, so being your immunoglobulins positive, having that positive, it's just take it as a great news, okay, wow, I have the immunity already, probably I went through that, I recovered, was asymptomatic or whatsoever. I think there's nothing wrong in being naturally immunized to COVID-19.
Herd immunity. It's going to be the only way forward. I absolutely agree with you. And if somebody were to tell me, yeah, you had the infection already and you weren't sick, I'd be going, I'm going back out, man. I'm good
Yeah,
to go. I
yeah.
think that's going to make people happy. But you're right. It's the stigmatization, and the lack of information. Because most of the calls I get are not from old people or diabetics or hypertensives or obese people. The the the
Herd
people who are
immunity.
calling are
Yeah.
people who are just afraid, and their fears aren't realistic by who they are, being young and healthy and unlikely to have a severe form of the infection. I got young guys calling me and they're saying, "Listen, I just went to the pharmacy. I got to get some hydroxychloroquine." And you're looking at them and going, "Well, the chance of you ever needing it are probably pretty, slim to none." So, the greatest thing we can do with telemedicine is to educate educate people and calm them down and talk them off the ledge. Um, but the truth is that now people are going to find out that they don't need to go see their doctors,
Mhm.
and they can do more telecommunication, which for guys like you and me with patients in so many different countries is going to open up, a whole new world of communication and the people we can
Make
reach.
things
So,
easier, much easier. Yep, absolutely. What's your opinion on hydroxychloroquine? First of all, there are two a bit different drugs. One is hydroxychloroquine and the chloroquine, the other one. The later
mhm,
being more toxic version and the hydroxychloroquine generally a safer version of the same drug, which is used in malaria. Speaking of
right.
malaria, throughout the same period from 1st January until now, the pandemic of malaria has taken about 260 or 280,000 people, which is
Mhm.
a few times more than COVID-19. Why is that happening? Because they have a lack of medicine. Does that mean that, wow, if we have 200, like quarter of a million people dying because they can't get the chloroquine or hydroxychloroquine, which is a medication for malaria, and now we have another
Mhm.
couple of million of patients with COVID-19. So aren't we gonna be panicking? Or do you think that the fact that somebody is positive but in a mild form or asymptomatic does not mean that he has to start taking hydroxychloroquine immediately? So what is the threshold point when to start hydroxychloroquine and when not to start, and just rely on the immunity and natural cause of the disease?
If it were me, I would kind of use it in the same way that I would stratify risk with somebody. If they had a risk factor leading towards um, that I thought that they were going to develop pulmonary inflammation and pulmonary disease, which is what's killing people with
Mhm.
COVID-19, then I would start it early. I worked in Africa on and off for 10 years, so quinine, chloroquine. We couldn't get a lot of hydroxychloroquine because it's too expensive. But these are drugs that were available in the 7-Eleven. They were all over the counter.
In
So
Africa.
these are. Oh yeah, you don't need a prescription for these in Africa. You just go into the pharmacy and buy them, like you buy amoxicillin or you buy anything else, because people don't go to the hospital when they have malaria in West Africa and East Africa, because why would they? They got the treatment right there.
You
The
had
doctor's going to give them
malaria
the same thing.
yourself, right? When you were
Yeah,
on
yeah,
the Ebola mission, you had malaria, and you completed the term, whatever you had to your service there, and all with been recovering from malaria. Correct me if
yeah.
I'm wrong. Yeah, that's
Yeah,
pretty
well, I mean,
remarkable. That's
as the story
incredible.
goes, it was even worse than that, because um, I thought that I had Ebola because I had been exposed to Ebola blood during one of the times I was treating a patient. I had my two gloves rip open, and the patient was seizing, and he bit through his tongue, pulled his IV out, and there was just blood and saliva everywhere. And so I had an exposure, and it was pretty daunting. And then I developed a fever 26 days later, even though I was taking Malarone, malaria
Mhm,
prevention
mhm.
uh, medicine. And so, I thought first, I go, oh my God, if this is Ebola. And then I found out it was malaria. And I go, oh, thank God I have malaria. I just take the pills, keep working. I mean, I felt awful, but I was still ambulatory, could still work. Um, but going back to the hydroxychloroquine, um, it has an acceptable risk profile. The studies that they did in France make sense. In theoretical sense, what it does is it stops virus from leaving the cell. And so that way you're not going to have the entrance into so many other cells, less inflammatory effects on the lung, and the people are dying because their lungs are inflamed, right? And they can't use their lungs filled with water, can't breathe, you're going to die.
And the iron knockout from the porphyrin ring also, so it affects the RBCs by knocking out, the ORF8, ORF10 enzyme. Yeah, it knocks out the iron from the porphyrin ring in the heme molecule. That's you actually have a tremendous amount of iron, extracellular iron, and the free porphyrin, which contributes to the chronic inflammation. The whole hyperinflammatory syndrome, and then creating the thromboembolism, and stuff like that. And you have a defective RBC, which is not capable of the proper oxygen transfer in the same time. So it's really a tricky virus. And the fact is that it prefers selectively choosing that hemoglobin molecule, which is highly glycated. So when you have the HbA1c high, you're actually opening the gates for the virus. Just please enter and hijack my RBCs.
But I would, it's been my experience as a guy who's treated a lot of viruses over the years that sometimes you got to bite the bullet and use a drug instead of waiting to use it as a salvage therapy. Because once you try salvage after the lungs are already inflamed, it's not going to work. You'll save a lot less people. And like I said, the side effects with hydroxychloroquine, there's some people who get arrhythmias from it. You have to be very careful with those people if they have a history of AFib or PSVT or another cardiac. I'm certainly not a cardiologist, but I think it should be prescribed by a doctor. The doctor should look at the risk factors like we do with any other treatment that we do with any other patient, and it should be available as a tool, especially in the time where we have nothing else. The worst thing for a doctor to do is to have to sit there and watch a patient die when you can't do anything. And as much as the politicians want to comment on it, I'd like to put them in our shoes once in a while and say, all right, what would you do here? And that's the way I look at it. Of course, I'll never be in politics. I'm just going to try to tell the truth.
Yeah, well, let's stay away from politics and stay in medicine. That's what we do best. So apart from vitamin C, vitamin D, maybe hydroxychloroquine when it's indicated, the high temperature therapy, what else can be used? Like hyperbaric? What do you think of that? IV ozone? Whether it will create that extra oxygen, have that some effect on the virus itself, the intravenous ozone, So are these therapies, to what extent they can be used as prevention, reducing the personal risk, and maybe as a treatment in some early or moderate stage of the disease?
Well, I like ozone as a therapy and as a theoretic therapy also. I mean, in my clinic, in Bangkok Anti-Aging, we do quite a bit of ozone therapy. Ozone therapy has a theoretical advantage of increasing NK cells, like you said before. It also can have a direct antiviral effect, kind of an antioxidant effect as well. And I'm a big fan of putting more oxygen into my brain. I think hyperbaric oxygen would be better, as far as I'm concerned. We don't have a chamber in my practice, but I do want to get one very soon.
We have one.
I think
we have one in our setting in Bangkok. We have in our setting in Bangkok.
Do you spend time in it?
Oh, I love it. Oh, well, there's a bunch of things that I really love. I love hypothermia. Okay, all sorts of it, whether the infrared sauna or the systemic hypothermia, the German device, the medical use device. I love hyperbaric oxygenation. I love lasers. I love the low level lasers, all the red light things and all. These are the things that, when you understand how it works in principle on the biological level, on that fundamental biochemistry, and just don't overdo it. Like once 7 to 10 days is one session of hypothermia would be enough, like once in a week, not more than that. And plus the IVs, all these cocktails, just do it moderately, like once in 2 weeks or once in a month. But I do take a lot of supplements, and a lot of stuff, so including the metformin, so I'm a big fan of the metformin theory. Although, as you have mentioned before, I do everything in cycles. I sort of give a stressor, I give a relief and a support, functional support to my systems and all. Then I just give some time for it to recuperate, to sort of rebuild itself, and enjoy the effect, and then wait for the normal natural process of aging again to kick in, So you can't be maintaining yourself indefinitely, it's just unreasonable. So and
Right.
after that, just repeat another cycle, and also as long as you know where to stop, although we both know how sometimes you enjoy the effects, so it works on the dopamine receptors, you want it better and better and better and better. Just don't lose your mind. Don't lose your mind,
Yeah.
while doing that.
Yeah.
How about your leisure time? Well, I believe that I know that you're a loving father, your wonderful child boys, I see the pictures, and then you're very much involved in that. But I know that you, before the lockdown started and after it will be over, you have also some remarkable singing capacities, and you have a band or something like that when you guys like semi-pro, but you have those regular gigs, right?
I sing. I grew up in a musical family. My father was one of the most amazing piano players I've ever heard. He was a jazz piano player, and always promoted music in a family, which I'm trying to do in my own family too. I think it's great for the kids' development. But I started singing about only 6 or 7 years ago. I was a piano player and guitarist before,
You're the
and
late bloomer in music.
well, this is the great thing about anti-aging. I can bloom at any age. Uh, but
And
yeah, for
another
the
great thing is that you can take up a heavy load of work as your retirement plan. That's another benefit of
exactly.
biohacking and anti-aging.
But that leisure time is really important, and the endorphins that you get from doing something that gives you such tremendous internal joy and happiness. It's hard to put into words. But I sing with a couple bands, and there's a piano bar I sing at here also. And guys like you and us are so intense with our work that unless somebody forces us to put it down and do something else, if we don't have a dedicated distraction, we will end up working ourselves too much, not to
I
death,
work
because we do
24/7.
anti-aging.
I
Yeah.
work 24/7. I don't have office hours. I'm available all the time. I live it. My work, what I do, I literally live it. This is my life. I'm fully dedicated. I love it. So there's no before office hour, after office hour. So this all is just an experience and a style of life. And I would love to come, if you don't mind, and visit and see how you guys play, and maybe you can teach me. Well, it depends what you are singing, but if you sing few songs of Deep Purple or Metallica, Black Sabbath, I might be joining.
Yeah, well, the bands we do everything from the jazz classics right up into Metallica and 70s rock and everything. So you would be more than welcome next time you're in town. You have to let me know.
Absolutely.
Um, but I think Dmitry, I think it's starting to get on the late side for me. I have to tend to my children.
Yeah.
But there's one thing that I want to talk about, and I want to do it next time because this is going to have to be a lot of dedicated time. Um, as a student of immunology and a student of regenerative medicine, there's the little guys here.
Hi, young man.
He went to the refrigerator. Um, I'm very interested in the effects of cell therapy and stem cell therapy on how they actually affect an aging immune system. And that's
Immunosenescence.
very important to me because, as much as people focus on, oh, we don't want to do these therapies because it gives people cancer, you could get cancer, you get cancer. I still feel that these therapies give you such immune modulation that your ability to prevent cancers goes much higher than it would for anybody else at a age to age comparison. So
Yeah.
next time we talk, I want to know more about that.
Great. And I'll fix for the next time our next meeting. Dr. Erik, it's been a great pleasure. Thank you very much, sir. I wish you and your family the best of health. Stay safe, be healthy. God bless you, and see you soon. And thanks to
Great.
everyone who has been watching us. This is going to appear on the YouTube channels and all. And I love what I do, and part of what I do is communicating with such great people as Dr. Erik Fleischman. Thank you very much, brother. I really appreciate
Thanks,
it.
Dmitry. Like I said, I'm a huge fan of the work you do. There's not a lot of doctors as I hold it at that kind of esteem that I really enjoy. Yeah, there's a lot of good doctors, but there's not that many incredible humanitarian doctors, and you are one of them. And so it's a real pleasure
Honored,
to
honored.
talk to you and associate with you.
Thank you, sir. All the best.
All right, buddy. Take
Yep.
care.
Take care.
Bye-bye.
Bye-bye.